Hello, everyone. Welcome to Tigerlily's Pull Up a Seat, navigating policy shifts and staying true to your mission. My name is Daria Ross, and I am a Tigerlily Angel Advocate and a patient and community impact advocate. And I will be your moderator today. I am a 6-year triple negative breast cancer survivor, and I'm also someone that is deeply committed to ensuring that our policies and systems reflect real lives and voices of those that are most impacted. Today, we're not just discussing policy, but we are reclaiming our power in how policy affects our care, our communities, and our healing. It is truly my honor to be here with you today to guide this powerful conversation with you and all of our incredible dynamic panelists. Today's session is designed to offer clarity, emotional grounding, and actionable strategies as we navigate an ever changing, ever evolving policy landscape while we stay rooted in our mission and our values. But before we dive in, I want to invite each of us to take a breath and set an intention for learning, for connection, and for courage in advocacy. Our goal today is to hold space for truth, knowledge sharing, and collective empowerment. We're going to explore policy basics, how to manage that emotional toll of change, and how to stay true to our mission, like we've said, in these times of uncertainty. And then we're going to close with an audience Q&A. So before we go any further, I want to talk about the 5 agreements for today's space. Number 1, monitor your airtime and be sure to make space for others. Number 2, speak your truth. Your experience matters. Speak from your own experience. Avoid generalizing. Lead with curiosity. Be curious, just not judgmental. And lastly, let's keep this a safe space because we are all here to support one another. So next, I'd like to have each of our incredible, dynamic, amazing panelists introduce themselves. You each have 1 minute, and let's begin with Keisha Stephanie.
Good morning, everyone. I'm Keisha Stephanie. I am a two-time triple negative breast cancer thriver. My glasses are crooked. So I am also a Tigerlily angel, and I also am a founder of a nonprofit called the Peach Pink Project. I'm very proud of that because it is me turning my trauma into my purpose, helping other survivors like myself navigate through systems and give them support and empowering them to be their best advocate.
Thank you, Keisha. Next up, let's go to Lachelle Scott.
Good afternoon, everyone. I'm Lachelle Scott. I'm a stage 3 breast cancer patient, policy advocate, and lobbyist. My organization, besides being a Tiger Lily Angel Advocate, is called the Hope Project Initiative. And what I do is I actually go into different state levels and lobby for policy from federal and state. So thank you guys for joining this, and I'm so excited to be here. The great opportunity to share something that's of urgency at this point in time. Thank you again, Tigerlily, for all you do.
Thank you, Lachelle. We are so honored to have you with us today. Next up, let's go to Michelle Anderson Benjamin.
Good afternoon, everyone. My name is Michelle Anderson Benjamin. I am the CEO and founder of the Fearless Warrior Project and the Fearless Warrior Organization. I am a certified mental health coach and advocate, certified deaf doula, and also an angel advocate. And I am also a stage 4 thriver. I am a community scientist, and I do wear a lot of hats, but I am truly honored to sit on this panel today to discuss policies and ways to make them work for you. but also to educate our community on our rights and what we can do despite all things. And most importantly, regardless with having cancer, you can be the sexiest, most beautiful, confident person and still live your life resilient. And I'm grateful to be here.
That's right, Michelle. I totally agree. Thank you so much for being here. And then we have Erin Price.
Hi, thank you so much. I am honored to be with you all today. I'm Erin Price. I'm an oncology social worker at Smith Center for Healing in the Arts, which is an integrative cancer support nonprofit in Washington, D.C. I've been with Smith Center for 13 years. And I'm also a breast cancer survivor myself. I was diagnosed with ER positive, HER2 negative breast cancer at the age of 28. So I'm going on nearly 15 years of survivorship. And truly, that is what brought me to my work of wanting to help others, help other survivors, help other young people with cancer. And I've really focused on trying to help people feel normal and survive and navigate the emotional fallout that comes with a cancer diagnosis. So it's really great to see you all, and I'm glad to be here.
Thank you so much, Erin. I identify and what you say resonates deeply. Those are my reasons for being here too. Welcome. We're so happy to have you. So, as we begin our first panel, please feel free to add your questions to the chat at any time. Our Tigerlily team will be behind the scenes monitoring that chat, and I will also do my very best to direct your questions to the panelists. So don't hesitate to ask questions. So first, we're going to get into our first segment, and that is understanding policy basics, right? You know, policy isn't just paperwork. It determines who receives care, the type of care that we receive, how quickly that care is administered. So let's break down the systems that impact us and how we can better navigate and influence those systems. So my first question is for Lizzie. Lizzie, can you briefly explain how policy changes can directly impact community organizations or access to care? And
Sure.
before I do that, I just realized something. We didn't introduce Lizzie. How can I forget that? Oh my gosh, I am so
That's okay.
sorry. So
No.
before we dig into this discussion, everyone, my apologies. Can you introduce yourself as one of our illustrious panelists as well?
Thank you, Daria. I'm super honored to be here with all of you amazing advocates. I am a Tigerlily staff person. I'm the director of our HEO Policy Center of Excellence, which is the policy arm at Tigerlily. But I'm also a breast cancer patient advocate for 20 plus years. My mom was diagnosed with breast cancer when I was 16. It was just two of us. I became a caregiver to her through her journey and learned a lot through that time trying to navigate our very complex health system, which is what pushed me to get involved in public policy. And I actually got the chance to go to my first lobby day, state lobby day in California with my mom before she passed. And it's something I fell in love with. It was the way I saw that we can help and impact hundreds, thousands, millions of people. It's the same way I was kind of helping my mom one-on-one with caregiving. So I've been blessed to be able to do that for all these years. Happy to be here to chat about it, and happy to address this question. And thank you again, Daria. And I think for me, I've heard this really great analogy for policy, because I think it's the type of advocacy that seems a little more esoterical. It's harder to grasp and understand. It's not as comfortable. It can be a little bit more scary for all of us. But this analogy I've heard and I like, and we'll use today too, is to kind of think of policy as like a playground in the sandbox that we all play in or live in or get healthcare in this instance. And policy are the pieces that affect that playground, right? Like policy is the playground rules almost. It determines what equipment is available, who can play, the safety standards, what's available for everybody. And as those pieces shift and change, the playground changes. So, maybe the swings are a super popular thing in the playground and there's not enough for everybody. So we put in another set of swings so that there isn't a long line of people waiting to get it. we hear this about access to screening and treatments and modalities that are advancing technology within the healthcare space. You know, and sometimes things get outdated. I don't know if you guys remember those old, I'm dating myself, metal slides that would burn your legs if you went down. You know, and policies are the things that get those swapped out for the newer plastic ones, the rubberized ones, all those kinds of things. So it might not be something visible every day, but it determines our total environment around us. And so there's all the different players we know, you know, patients and communities, the hospitals, the clinics, the providers, everybody that is doing the healthcare, the people and payers who are paying for it, insurance companies. But there's also some hidden players in there too. We have things like middlemen or PBMs, pharmacy benefit managers, and all these things that different policies, sometimes not even healthcare related policies, affect through budgets and things like that. So as all of that shifts, you know, it affects not only community organizations like Tigerlily, but all of us. And so those things can determine one, funding, very important, what's available. All these things cost money, unfortunately. And so sometimes they're funded by the government, sometimes they're funded by the state, sometimes they're funded by other entities. And as those budgets change through policy making, that affects what's available and who has access to what. I know like the Medicaid cuts recently in this newest reconciliation package. You know, a lot of people are worried about that, and that's a big effect. So there's a lot of different ways that these things can affect not only access to care, again, that kind of slide or swing analogy, you know, how many of what is available and how long access takes and if it's affordable, but also the general funding and support and infrastructure behind all of that.
Thank you so much for that, Lizzie. On a personal note, I just want to say that Lizzie has been an excellent mentor for me in this policy landscape. I love how you frame that as, you know, policy are those playground rules. So often we hear people say, well, I'm not really into politics or politics aren't my thing. But when you understand policy and how it shapes our everyday lives, then we are all into politics. We are all affected by it. And I've been very fortunate and blessed to advocate on Capitol Hill in DC at least 3 times and also at the state level in my home state. So I love the framework that how you've shaped this. My next question would be, what are some essential resources that advocates may not know about that can help them effectively navigate policy change? And I think, Lachelle, can you give us your thoughts on that?
I love Lizzie's analogy. Just to piggyback off that a little bit, why it matters for a patient like me, where Medicaid expansion is not offered to me in the state of Texas. I am a recipient of the ACA, the Affordable Care Act, and under that, I was afforded tax credits. However, when the new legislation was signed in by the current administration, I lost my tax cuts. So I immediately received a letter from the healthcare exchange. And then the next letter I received was from my insurance provider telling me that my premium was going up. So I'm going from paying $25 a month to close to $800 a month. And that kind of started this month. And why, you know, people say, yeah, it's not important about, you know, being engaged in the policy, but policy is everyday life. Some of the resources I can give, Google is an excellent, your state legislative legislators have websites. You can go and Google policy. We are currently in a special session in Texas where I see that Medicaid expansion is being proposed again, and hopefully we can get it passed. If not, we just got to keep trying. Also, just following up on Congress, what's going on in Congress. They have live feeds you can watch when they debate in the subcommittees, budget committee, and you know you may not think it may not apply, but you'll be surprised what's buried in a lot of the policy that's being passed.
That is so helpful. I think often people don't understand that connection to them as individuals. So, like you say, you're offering different ways. And I like to use the term the squeaky wheel gets the oil. And what I know for sure is that when you engage with your legislators, be it at the federal level, the state level, or even the local level, um, they get to know who you are, and your level of engagement will change, and they will communicate with you. And that's how you make that small incremental change, even if it seems overwhelming. When you think about like the Medicaid cuts or the cuts to research at the National Institute of Health, those things have a direct correlation to cancer care and cancer research. But us being there, being present, I think that these are really, really effective tools. I was going to ask if you had any more specifics, either of you, in ways that we can stay informed, or what you would suggest as good, trusted sources, briefings, or networks if people want to have a regular cadence and stay informed and really connect with policy.
I would say get to know your representatives. They are become their best friend. I had the fortune of working in politics before I got my diagnosis. So I already knew people. And even, now I get to know other new representation. But it's so important to know who represents you. Even from a community standpoint, there are community-based organizations that do deal with healthcare, and they have free events. You learn a lot that way, and I go out and meet new network connections that way as well. So just from a minute standpoint, going to events, community events is a great way. A lot of people don't know. Of course, in Texas. We Texas Southern University has a breast cancer um, research group, and I sit on the board. But they have an event every October, and they invite the community out, and various organizations have tables. And I had a table for Tigerlily one year, and I gave out information and talked to the students and explained to them how important this is. And cancer is not an old person's disease.
Yeah, I agree with everything you just said, Lachelle. Just to give some specific resources, like Michelle said, know who your representatives are. So for the federal level, you can go to congress.gov. There's a search, type in find my representative, you put in your address, it'll give you all your representatives, both on the House and the Senate. You can do the same thing at the state level, at your state legislators website, which is different for each state. Votesmart.org is a website I really recommend too. Unbiased, unpartisan. You can go in and look up different bills and laws, get information. You can also research specific legislators and representatives to see how they have voted, their voting history in the past. You can go on their websites to see that as well, which you can find through congress.org. But it's just nice that way, before you do have meetings, you can know a little bit about them. You can thank them for what they've done in the past to support your issue, or see that they haven't and try to find why, and share your story and let them know that that's important to you. There's also at congress.gov, it lists every bill introduced in every Congress. And so you can look at them there. You can see the full text, which can be kind of jargony, but for most of them, there's also a summary that makes it a little bit easier to follow. You can also see who authored it or introduced it, who the co-sponsors are, and you can even track it. So you click a little button and it'll send you an email anytime there's an update, a new co-sponsor, it moved to a new committee, it's being voted on. And that's really great because then you can track that and engage at all those points too. So those are some of the specific resources I like to recommend as well.
Thank you so much, Lizzie and Lachelle. This is so helpful. One side note that I want to add, when you are advocating at the federal level and you're there in DC, always remember that these legislators have local offices. So getting to know the staffers at the federal level, even if you don't get FaceTime with the actual legislators, learning who the staffers are and getting to know them at the federal level and also the local level. So they all have local offices. Getting to know those staffers is so important, because they're just as important. They have the ear of those legislators. So I want to give you that suggestion too. Send them an email, make phone calls. Phone calls are great. They track those phone calls. So that would be my suggestion. Um, Before we move on, I do want to ask if either of you have any key indicators or ways that we can identify key indicators that a policy shift could possibly affect our mission. You know, we hear so much in the news and it's easy to get overwhelmed. But from a policy perspective, if there's a simple way, if such a thing exists, to just kind of say, this policy may change and it's going to affect my mission. What would either of you suggest?
I'm in Texas, so that's kind of hard to say sometimes. Usually I'll look at and see what they're talking about. Like I said, we're in the middle of a quote unquote special session, and I caught that they reintroduced Medicaid expansion again. And so I've been trying to pump that out because I'm not in Texas right now, and signify the importance of that. Hopefully, I've been talking to the person that sponsored the bill about what's happening with the ACA and the tax credits and what's happening with patients like me. So I follow just the best. My one to go to is always follow your representative, and you definitely get to know their staffers because they'll be your best friends, and they'll kind of give you an idea how the legislators, the lawmakers, going to move on certain bill, and just share your personal testimony. I find that goes a long way than just reading from a script or bullet points. Sometimes just telling your story, is very impactful.
Absolutely agree with everything you said, and would also add finding out the committees, whether it's at the state or the
Mhm.
federal level, that oversee the types of bill, like for our conversations today, healthcare bills, which can be a little tricky. I know we're going to talk about the policy process a little bit more details in a minute, but there are specific committees that they usually pass through on both sides, both at the federal and state level, and you can actually watch and attend those hearings and meetings. So even if you're not in DC, but you want to watch them, they're televised. You can go online and watch them live streamed. You can attend them in your state, and usually they're live streamed as well there too. And they're open to anybody. It's called testifying, and they're called hearings. It's just a meeting, like a town hall. It sounds scary. They do it on purpose. But you just go and attend, and like Michelle said, it's called testifying, but you can share your personal story and why those things are important to you. But kind of following those committees and hearing the conversations that they're having, you can kind of see the trends that are coming down the pipeline that year. And then you can kind of follow it and see how it will affect your mission, whether it's at your organization or your personal advocacy mission, and kind of be prepared or preemptive that way. And so when you are having these conversations, you can bring that up because you don't want to wait until a bill's passed. You want to be involved in the process before that, which I know we'll talk about in a minute too. But I agree 1,000% with everything Michelle and Barry you both said.
So good. Thank you so much. And what did you say those town halls were called? I know it's a town hall, but you gave it a name. I want to make sure everyone heard that.
Oh yeah, I'm sorry. They're hearings, and I was just comparing them to town halls. They're really just meetings, and they're meant to be open to the public. Although at the state level, especially, they're not great about announcing them in advance, and they're usually middle of the day on a random day and announced with less than 48 hours notice sometimes, which
I
is a different
just
discussion.
I just kind of want to piggyback off something with Lizzie. You can also submit, I know in some states, you can submit written testimony on policy if you miss the meetings as well.
That's right. You sure can. Yes, this is all good. And so you're right. It sounds intimidating, but it's for the people. So we can have a voice, we can be present. These things are open to the public, you can attend. And it's such an enlightening experience, and you really do learn. And then it's not so overwhelming, right? Okay, really good. So I was looking to see if there were any questions in the chat. I don't see any, but everything that we've referenced, congress.gov, Vote Smart, all of those things are in the chat. So be sure to capture those for reference for later. Next, we are going to go on to segment 2, managing the emotional aspect of the changing policy climate. And for this segment, our panelists will be Keisha Stephanie, Lachelle Denise Scott, Michelle Anderson, and Aaron Price. So, policy doesn't just affect the systems. These changes affect our spirit. So, what does advocacy really look like when we are tired, when we're frustrated, when we're grieving in the midst of policy change? How do we stay grounded when the ground itself keeps shifting? As we face uncertainty in policy, I'd like to know from the panelists, and whoever wants to chime in first can, what emotional responses tend to come up in your personal experience? You want to start with that, Michelle?
Oh, you said, just want to make sure. You said Michelle, not Lachelle, right?
Yes, Michelle.
Just gotta make sure.
Yeah.
Um, a lot of emotions come to surface. More importantly, the uncertainty of care. I also work in healthcare, so I am a cancer patient and also work in a cancer institution. So just, a lot of patients will have that fear if their treatment is going to be interrupted. We've had instances where treatment was delayed because of insurance, certain things have to be approved, and a lot of times that doesn't happen until day of. And some a patient who might have their treatment duration might have been 2 hours. Now they're in the hospital for 7 hours because you're waiting on if it's going to go through or not. And I just think that's like the worst thing possible. It really doesn't make any sense. When someone's life is on the line, everything is kind of based off of politics. So a lot of it is more so redirecting those emotions and trying to keep people at a place where you understand their frustration, but you also try to give them hope and give them patience and pour into them, because having a disease like cancer is much bigger than an illness. If you're emotionally unstable and you're stressed, that also adds to everything else and contributes to the breakdown of the body. As a patient advocate, one of the main things I always tell people, our medical teams focus on curing the disease, but they don't understand that it's the whole body that has to be treated. Because if the person is not in a mental space to show up, outside of life doesn't stop because you have cancer. We have to still do our day to day. We still have to life. So those other factors always have to be also a priority. So one of the things I always push is clear communication. A lot of times people understand if they're aware, but when you're in a position where it's just thrown at you and you just gotta like deal with it, that's when it becomes alive. So just having clear communication on what's happening. Be proactive and not reactive. If we know that these things are happening, let's have plans in place to try to work around it. But also that we're encouraging and continuously pouring into the individuals to let them know we understand that this is an uncertain time, but we're going to try to figure it out. We all live on a life of hope. No one has the clear answer, right? But if everybody is in running in the race with you, then you feel supported.
I think that is incredible. I totally agree. Keisha, I see you nodding your head.
Yeah, just to everything that she said, is exactly what I'm thinking. And, and I say this lightly, but I say I benefit from living in California because California, despite all of the expensive as it is expensive to live here, let me tell y'all. But for the most part, healthcare wise, they kind of they have been taken care of. Someone said yes, it is. So they take care of their people. But doesn't mean that the policy doesn't affect us as well. Those that are not receiving benefits from employers or things like that, or it's very hard and it can be very stressful, like Michelle was saying, especially at a time where you should be, thinking about taking care of you. right? And what you do have that uncertainty of, is this my next scan going to be, approved? Or if you're in the middle of treatment, I heard Lachelle say how expensive which is insane, how expensive her healthcare is. Is it going to go up, or is and you shouldn't have to feel that way and worry about those things. So I think a lot right now, especially with all of the changes, people have a lot of anxiety, a lot of fear. I mean, they're very unsettled, right? And what I have explained to people is that you can only control the controllable. And one of the things that is that you can control how you are reacting to what's going on, because how you react is also going to affect, like Michelle said, your healing. And so, continue to advocate for yourself, ask questions why, if they're denying something, why, do an appeal. A lot of times people don't realize that you can appeal things, that were denied, your services. Make sure that you are staying on top of everything that your care team is presenting to you. If they push, I have an example. This, it wasn't because of policy, but it can fall into that. About trying to push my scans out to a year. No. Right. So I don't want to push them out to a year. Give me the reasonings that, that you want to do that. Explain to me so that I can understand where you're coming from. You're going with the science. I'm going with Keisha's body and how Keisha's mentality is. Right. And so things like that. Right. Ultimately, wasn't ready. Make sure that you tell them, I don't feel comfortable with this. I need to, I'm a firm believer. I need to speak to the manager. Because until you are satisfied with the explanation, you keep asking, and almost demanding even. So that's what I tell people all the time that are going through some things like this, that are nervous about the policy changes. Just the main thing is control the controllable, and advocate for yourself. Ask those questions. Make sure you're getting those answers. And at the most important thing is making sure that you keep yourself grounded, right? Because you don't want something else to come about because you're worried and stressed about what could happen.
Totally agree. Thank you for that. Aaron, I see you nodding your head, and I know you have much to say about this, and I really want you to talk about this and really talk about, the toll, navigating those emotions. What do you have to say about that?
Yeah, I think, you know, uh, I'll start with the headline, right? That the whatever you're feeling is normal. There is a range of emotions that you could be feeling. Things can impact you in a different way. It might impact you in a different way than your friend. That's okay. You can feel anger, fear, worry, stress, frustration, grief, and you might feel hope. You might feel resilience. You might feel strength. You might feel resolve, inspired, gratitude, right? We can feel both of these dynamics at the same time. Complex human emotions are complicated. We often feel conflicting emotions. That is okay. There's not something wrong. You can feel grief and hope at the same time, joy and fear. It's normal, it's expected. And most importantly, there is not a right response to any of this. Your response is the right one for you. I really love what was said about you can only manage what is controllable, right? And so
Control the
manage
controllable.
your response, and navigating the realness of the emotions you are feeling is important, and being able to identify that. And if your friend or everyone else is feeling angry and you're just feeling worried and hopeless, just acknowledge it, right? We can work with that. You can bounce from it. um, so I think that's really the biggest thing I would want to say about emotional responses. I mean, I think there's a lot of strategies that we can talk about, and I don't know if you're ready to move into that yet, but I wanted to just acknowledge this full spectrum of humanity.
Yeah, I absolutely do want to talk about it. I love what Keisha said about controlling the controllable. We all know that when you have a diagnosis, not only are you managing your own emotions, you're also managing the emotions of loved ones and everyone around you. And so controlling the controllable. And as you say, Erin, acknowledging all of the emotions, because several things can be true at once, acknowledging all of that is so critical. But I do want to get into some strategies, and that was my next question. And I think I'd like to lead with that for you, and then Lachelle, you can chime in as well. What are some tangible strategies that you recommend for staying emotionally grounded and resilient?
Sorry, me?
Yes.
Yeah, great. So I think even in times when we feel frustrated, it's really important to lean into the things that bring you joy, peace, restore you, right? You have to figure out what those things are. We don't want to let our body and mind live in a state of constant stress. There may be constant stress around us, but when we let our body stay in that constant stress response, we are not optimizing our bodily function to live healthy, right? Our immune system is not working properly. We are not coming down. It's actually, maybe a breeding ground for disease and illness. And we want to stay healthy, right? We want our mind and our body to stay healthy. So reducing stress is really important to that. It's hard when we live in a state where there's lots of stress around us. So we have to be very intentional about how we counteract that, what boundaries we try to maintain. It's not healthy or helpful if we can't take care of ourselves. And when we have bandwidth, time, energy, we when we take care of ourselves, we have the bandwidth, time, and energy to help others more. That cold adage of you can't pour from an empty cup. So really, I encourage people to check in with themselves, understand what is most important to them, take time, even if it's just a few minutes, to catalog what things help you when you feel stressed. What things help you cope with your distress? What activities, peoples, tools do you already have that you can lean on? Take some time to brainstorm and write that down. And then when you are in those moments of distress, you'll already have that list written out that you can turn to for inspiration. Truly, this list should be unique to you. It does not, it shouldn't be this very stereotypical of like bubble bath, meditation, long walk on the beach, right? That might not be the thing that works for you. It really has to be helpful to you. If it's not, if you hate bubble baths and it's going to stress you out, take a bubble bath. Please don't take a bubble bath, right? Like that's a very generic example, but it should be stuff that restores you as an individual. What works for you may not work for someone else. Tools like mindfulness, meditation, maintaining good boundaries, self-care, wellness practices, there's truly an endless list of possibilities, but it has to be stuff that works for you. And truly taking care of ourselves in times of stress is one of the most powerful things that we can do to help maintain and do the work. So it really is just so foundational.
That is excellent. You really dropped some priceless gems there. So I hope everybody was taking notes. And also remember, if you have any questions, please put them in the chat. This is so helpful. The concept of checking in with ourselves is so critically important. And also, I love that you said figuring out what is important to us. So by checking in with ourselves, determining what's important to ourselves, we can manage our emotions better in the midst of uncertainty. I think that is so vital. I love everything you said. Lachelle, I was just going to ask you about advocacy burnout. You do a lot of it down there in Texas. I wanted to know, how are you identifying it, and how do you address it?
Um, I guess because I work in politics, it's not a big thing to me. But I guess I'm not as stressed because I'm not in Texas right now. I'm in Georgia. So I got my brother, my mom, my nephew, and spending time with them, right now it's been an important focus. And I see my phone and my email buzz. I'm like, Michelle, where are you? We need you here. And I'm like, I'm far away. You're gonna have to kind of figure some things out right now on your own because I'm not there and I'm busy taking care, helping my brother and my mom and things of that nature. So they are giving me moments of peace and clarity about different things, even from finding out about my own health care. I don't think I got upset. I think because I was prepared, I knew it was coming. And I was just like, okay, so I'm now at a state where okay, what am I going to do for insurance in August? Because I can't see me having to pay that type of money. But journaling is helping. I have two accountability partners as well. So, this time away has kind of been a break as well. It's a long, far away break, but it's a break.
And you need that break, Lachelle. And so I think what I'm hearing from everybody, and Keisha, if you want to join in this part as well, is that we really have to prioritize what our set of values are and tap into that. And that's what will sustain us and help us manage our emotions and the emotional toll in these moments. Did you have something you wanted to say, Keisha?
Yeah, so that all of that, first of all, right? And for me, it's about community. So what I've learned over the past 4 years is that it is very important who I surround myself with, right? And that includes, and a lot of times people be like, oh, like your inner circle. And I tell people all the time, I don't have a circle, I got a triangle because it's very small. And getting in now, you got to have VIP access. And sometimes everybody don't get VIP access. And that's just the way it is. And I'm okay with that, right? Because I have set clear boundaries. I'm the queen of them now, where I wasn't before. And the other part of that is that you have to make sure that, you are doing the best thing that is for you. And that may look different for everybody, and it may look different to everybody, but that doesn't mean that it's wrong. That include I want to go to community because I want to say this because this is something that was personal that has happened with me over the last year. It's also about where you work. Right? I mean, everybody doesn't have the opportunity to just move around jobs, right? But I had to look at even my job. Are these the type of, is this the community at work that is going to support me, or am I going to be supported when I'm feeling stressed and they know that I have gone through what I've gone through? No, guess what? It was time for me to go. And so I had to move on and do so that I can do something somewhere else where I feel less of that stress, less of that anxiety, because what does that bring up? Fear, illness, disease, and ultimately death if you want to keep on playing, right? And so I don't let people play with me anymore. And I tell people all the time, don't let people play with you. Do not, right? You are the controller of your destiny every single time. And not just sometimes, but every single time. So you have to take control of that ship. And you have to make sure these people right here, they're bringing me down, I can't be around y'all, right? And when it comes to advocacy, it's okay. I did it. You all know I did it, to step back and be like, I need a minute. Because even advocacy can be exhausting. And my thing is that what I learned through a lot of therapy is that I was giving and advocating and going on panels and sharing my story and doing all these things. But I really wasn't diving into taking care of Keisha. And what I was doing, instead of taking care of Keisha, I was reliving my trauma over and over again, and nobody even knew it, not even me. And so you have to learn how to prioritize yourself first, take care of yourself first, and then go out and take care of the world, right? And that's okay, right? Have the gift of saying no. There you go.
I love that. I think that all of this is so foundational for us as advocates and survivors and thrivers, right? I'm hearing a lot about setting boundaries and the gift of saying no, right, Lizzie? Put that in the chat. I think that that is important. And I come from a loving family. I have a big family. We do so much together. And what I've learned is that even with your loved ones, people that are closest to you that you know are going to be there. It is even okay to set boundaries with them and to say no.
Mhm.
They may not be happy about it, but I want to lead with the fact that that doesn't change the love. That doesn't change the connection. We are still tight as glue, me and my family. But if I have to say no, or if something doesn't work for me, I too had to learn through therapy that it is okay to say no, even to the people that are closest to us, that we would give our last. You have to be able to say no. So I really, really love that. I'm just checking to see if there's anything in the chat. There is not. Michelle, you're back with us. Did you have anything else you wanted to add to this, or Lachelle, Aaron,
Yes,
anybody?
yes. Anyone that knows me, I am the queen of non-negotiables. And I tell people all the time, the same way you fight for your relationship, you fight for your friends, you fight for your kids, you fight for your loved ones, you need to fight for yourself. And when you start doing that, you start seeing parts of yourself that you never knew you had. Oftentimes we as individuals, we are so quick to pour into other people, but when we pour into ourselves, it comes with a whole bunch of hesitation, and we feel like we're doing something wrong. One of the things that was an eye opener for me is my therapist sat me down and she said, "Remember when you were told the words you have cancer?" And I said, "Yeah." She said, "Do you remember the person you was in that room?" I said, "Yes." She goes, "Who is the person who is the person you are now? What are all the things that you accomplished in that space? Stop selling yourself short." Sometimes we don't recognize our own superpowers, and with growth comes shedding. In order to grow, you have to let some things go. And some of those things are people, right? Everybody's not meant to come with you on every journey. Some people, they were just there for that first section. They're not meant to be in section 2. They're not meant to be in act 3, right?
Love it.
So being okay with that and understanding that it's all a process,
Yes,
and it's part of it's needed for you to become the best version of yourself.
yes, yes, yes. I love that. Aaron, was there something you wanted to say?
I love everything you said. I think that is so foundational and so important. The other thing I want to add just around this idea of boundaries, I often like to, boundaries are incredibly hard as much as we throw around the term and we're like, yeah, just have some boundaries. So hard, especially with people that you love and care for, especially with family. They're very hard to maintain. So if you're struggling with this, you've struggled with it in the past, just know it's okay. This is really hard. The more you change, the more the people around you want you to go back to who you were because that's more comfortable for them. We do it to other people too. It's just human nature. So if people are not respecting your boundaries, they're not always trying to be terrible people. They're just struggling with the change as well. But anyway, boundaries. The one thing I like to remind people, and this is sometimes I think the hardest thing to recognize, is that we are not responsible for other people's emotions, thoughts, or actions as much as we want to be, and they are not responsible for ours. And as much as we can remind ourselves of that, that helps with the boundary creation and reinforcement.
Excellent, excellent advice. I love that. I think that this is all super, super helpful and necessary as we navigate this changing policy landscape. We're going to move on to our last segment of the day, and we're going to continue our conversation with our panelists, Lachelle, Keisha, Aaron, and Michelle, on staying true to our mission during those policy shifts. In the presence of uncertainty, our mission remains constant. That mission is our compass. So we want to stick to it, right? Let's now explore how we can lead with values, not just be reactive and reacting to change. Um, and Lizzie's in the background, but I'm going to have her on standby too in case there's any questions and anything she wants to contribute as well. But I think I want to start with you, Aaron. How do you maintain alignment with your organization's mission amid policy uncertainties?
Yeah, I think, this goes back a little bit to what I said previously about, checking in with yourself, whether that's you personally or checking in as an organization, right? Again, checking in with what is most important. Um, we often feel everything is important, but when we have an honest conversations with ourselves or with our peers, we can get down to that core. I think we often feel strongly that we want to step in and help. We can feel compelled to do it all, with often driven by passion. And let's be honest, women are also often compelled to try to do it all as well. That's just as our nature. Um, but as we well know, this can lead to exhaustion and burnout. And this idea that doing more doesn't necessarily mean the product is good, right? That we're diluting our product when we try to do it all. So it's important to remember that we can't do it all, and we are not alone in this, right? There are other people, as evidenced by on this call, that care about the same things that we care about. And so sometimes the smartest thing you can do is be strategic, figure out what are your issues that are most important to you or your org, what are you uniquely qualified to address, and what resources do you realistically have, and how do they align with those first two things? Sometimes that means we have to let things fall, but we also have to trust that other people will be there to pick them up, because we are not an island of one in this. There are a lot of us with this voice. So we have to realize that if we can't impact these six issues, we can only impact these two, there will be other people there to pick up those other four and are already doing that work. It's okay. Try to do a few things really well versus trying to do everything. Make that deep impact versus scratching the surface. There are a lot of orgs and advocates, and perhaps maybe it's enlisting a coalition or a group. Maybe it's strategically dividing up issues. There are people already doing that work. Try to work smarter, not harder, and try not to reinvent the wheel. See what's out there. A ton of resources have been shared already. There's a lot of brilliant women in this room and connected with every person in this room. So let's use these resources in a coordinated way versus everyone trying to work in a silo.
Whew, this is so good. And I, as a public health graduate student, you are hitting every point that I am currently studying in my community engagement studies. So everything you're saying resonates. We don't want to cast too wide of a net. Realizing that we have to be strategic, understanding that we can't do it all, but we can do one or two things really well. And if we focus on those, we'll be effective. And again, that's how you make change and end up helping people and getting better health outcomes, because that's what we want at the end of the day, right? So, Keisha, can you share an experience of adapting while staying grounded in your values?
So one of the things that I loved everything that Erin just said, and one of the things that I do is I go and fall back on my why. Why am I doing the work that I am doing? I do that, and then I also don't compare what I'm doing to anyone else, right? Because what happens is every little bit counts, and my little bit matters. Advocacy and my nonprofit organization is a part of my life, but it's not my total life. And I have to continue to remind myself that, and those that I touch and inspire and encourage and empower, those, even if it's one, it matters. And so I stay with that, opposed to trying to put too much on my plate. So one of the things that, when you're starting a nonprofit and you have all these ideas in your head, I mean, because I'm an idea queen, honey. I want to do everything, but I can't, And so, funding comes into play. How am I going to get money, grant writing, and I'm working and I'm a survivor and I'm trying to live and I'm trying to, do all of those things. So one of the things that I did to adapt to that is that I really dived into my community. And, I started working within the community for donations and, especially with the sister stroll that I have, it has become something that I never thought it was going to become. I thought we were just going to go and walk and it was going to be all good. But it's actually, now people are asking me to donate, to the walk. And, I'm getting, calls from different people and stuff like that. So just making sure that I'm doing the most that I can with what I have available to me, the resources that I have to me, without overwhelming myself. I never went into the nonprofit saying that I'm gonna make this nonprofit. I want it to grow so big that I can quit my job and that I can just do this work. I know mentally that if I only just did this work, that it would be very difficult for me. So I recognize that. And so I now say, okay, these are the little bits that I can do throughout the year, and I hang my hat on that. So I think that if there's anybody on this call that's trying to their feet in it, I think that's where you want to start. And then as you hit those roadblocks, because you will hit some, it's just you continue to lean in on that. Why am I doing this in the first place?
I think that is excellent advice. And I just would like to add, I was around when Keisha was talking about the walk as an idea. I saw my friend have an idea and then it evolved and it grew and it grew. As your friend, it's been such a joy to see it become what it is now. So, what she's saying here works because it happened for her. I saw it happen, right? So, Lachelle, how do you or how can we make sure that our missions remain people centered, even when systems aren't? Because, like Keisha and everyone else, I'm in this space because of my personal experience, and I wanted to turn my pain into purpose, and I wanted to give back and help others and educate my community. So, how do we make sure that our missions remain aligned with being people centered, even when the systems around us are not?
I just like Keisha, I just always remember my why. And I remember when I started my group, I wanted to do this big elaborate event, breast cancer conference. And it didn't go the way I wanted it to go. But I said, you know what, let me take from this, learn from this, and rework my plan and try it again. But I ended up going into other directions on policy work. And I was like, okay, I'm pretty good. I think I'm pretty good. Okay with this. I can kind of understand this. And I like talking. So let me go talk. And so that's what I did. And that's what I do. And I know everyone in the space can't do certain everything. It's impossible. You just find the thing that you're good at and write out a plan and start plotting out how you want to implement your plan.
That is excellent advice. So, everyone, remembering our why, understanding what we are good at, where our talents, where our skills, where our giftings lie, and honing in on that and focusing in on that. And then just taking it one day at a time. And I also want to say, you know, this is a dynamic panel, right? But I know that everyone on this panel and in these conversations, we have experienced fear and self-doubt and been a little nervous. So I just want to say, if you're on this call and you're considering, do it afraid. Do it afraid because that fear will subside and the joy will come. And even with success, as we shift and change happens, you become afraid again, you know? It happens over and over. So it's a continuous cycle. So I just want to say, do it afraid. Um, if there, I don't see any questions, but I would say that if everyone could drop, if you want to, whether you're on LinkedIn, Instagram, or Facebook, if you could drop that in the chat if people want to connect with you. I'm seeing some requests for that. And now we were going to open it up. We have plenty of time here, but I want to make sure that if there's anyone that has anything that they would like to contribute to the panel, Lizzie, do you have anything that you would like to add to this discussion?
I just ditto to everything everybody said. Amazing. And just to add to, we started touching on Daria yourself right now. It seems scary, do it afraid, but just remember, like, I know, Michelle, you had experience, but thank you for sharing. Like, you went into politics not knowing, you know, anybody can do this. And like you said at the start, Daria, whether you're into politics or not, you are, because you're affected by all those policies. And you know, it's our responsibility to tell our representatives and policymakers what we need them to do, because they don't have your lived experiences, your real world experiences. You all are experts in that, your own healthcare journey, your own community. None of them are going to be experts in that. And so they need that education too. We talked a lot about community education and relying on our communities. And we have to remember that policymakers are a part of that community too. And we need to educate them. We need to activate them. But first, we have to be activated. And so going back to that why, whatever that is that's important for you, that's such a big step. And you don't need anything to do that. You don't need any training, any experience. Nobody needs that. I love one of the founders of GRASP, an organization we work with. She kind of coined this phrase that we all have a PhD, and that's a personal history of disease. So you go in with that title, you are the expert, and that's the same for policy.
I love that. That's right. There's so much power in storytelling, right? And you don't know the lives that you are touching just by sharing your story. There's so much power in that. And it is very effective at the policy level when we're talking to legislators and their staffers, right? Michelle, did you have anything that you wanted to contribute? You're on mute.
Oh, sorry. Just really, in the world we live in today, it's a constant up and down roller coaster of emotions. We don't know. One day it's A, next day it's B, next day it's C. And I just encourage people to just take a minute and breathe. Because, sometimes things happen or being done in a way to create panic and fear. And one of the things that I was raised by my dad is that control the things you can and finesse the things you can't. We can't change, we can fight and we can be proactive and we can be on the front lines of change and still do it with fear. But at the end of the day, the best feeling is knowing that you tried and you stood ground on what you believed in. And one of the great things my dad always says to me since a little girl, I don't want to see you, I'm not expecting you to win first place. I want to see you running. So never allow your values and your promises and your views to ever be tarnished or changed because of other people's concepts or other people's attempts to put fear into your soul. If you know that this is what you believe in and this is what you're passionate about, do it 10 toes down. Because even in this fight, we walk into these rooms not knowing what our outcome will be. We're very hopeful of those things, right? But we're not knowing what our outcome will be. But the reality of it is, we wouldn't have known that if we don't walk in. So the same fear that we walk into these rooms and say, Cancer, you're not gonna take away my joy. You're not gonna take, if this is gonna be my story, I want to make it legendary. I tell people this all the time. What is your legacy? Your legacy of what do you want people to say about you at your service, right? In order for people to have something to say, you have to give them something to say. So that means you have to be that person now. Like I know for sure my kid, I tell people all the time, my kids are gonna be like, my mom was a hot mess. She lived her life her way. She's 41, she thinks she's 21. But at the end of the day, that means I am living my life my way. I am not allowing stage 4 to take away that. I am not allowing the fact that I have to go to treatment every 3 weeks to take away that. I'm not allowing life or politics to change. And if this is, what my journey looks like, I'm gonna make the best out of it. It's certain things I can't change, right? I can't stop going to treatment. I can't stop doing these things, but I can go to treatment looking cute. I can be in the best version of myself. I can still show up in my best space. So control the things, control the things you can and finesse the things you can't.
I completely agree with everything that Michelle said. Cancer changed me and it completely changed my point of view in a way that I wasn't prepared for. And I can sit here today and tell you all that everything that I'm doing personally and professionally was nothing that I planned for. And for years, I'm the oldest daughter. I'm the first grandchild on both sides. I'm the oldest cousin. I'm the family manager. My family calls me the general. I'm such a planner. I'm a Leo, that's who I am. But I can tell you that my life as it is today is absolutely nothing that I planned for. Nothing. And I find so much joy in it and the passion in the work that I'm doing. And I don't want or wish cancer on anybody. None of us chose to be in this club. Whether we have experienced it personally or we've been a caregiver, we've all been touched by it in some way, but none of us chose this. But now that we are here to be in community, in sisterhood, to be edified, to be connected, to network, to be able to have these exchanges, it truly is a blessing. And it does amplify you, it does ignite you, it gives you power. And like I said, there's so much power in storytelling. So I think that embracing the change and being amenable and understanding that you've got to pivot and really understanding your limitations and setting those boundaries, if we do all of that, I think that we can navigate this ever changing policy landscape and it won't weigh on us as heavily emotionally. And we got to keep focused on our mission. I think all of that is critically important. But I want to thank you for sharing your story and sharing your experience in this space. And although it is not the path that any of us would want and that you would want, I want to express how grateful we all are that you are sharing because there is power in your story and you will make change, not just for yourself, but for others by putting that story forward and telling everyone everywhere you go about your experience. And with that, I want to toss it to Lizzie because I think she would be the good person to answer.
Yeah, Pamela, thank you so much for sharing that. And I actually, we got an email come through from you yesterday that we're putting together some resources for you. So we'll send that to you too. But for everyone, really great questions. And this is something we didn't have a chance to really address in that first segment, but we had wanted to. So we're talking about like big P policy and little p policy here. So things like cancer centers and medical centers, the policy within there is something not like it functions within the overall laws, but they set their own policies at each medical center. And so that's a piece you can also address. Sounds like you're trying to a patient abandonment claim. There's also other things you can do at that level. Most patient care places and cancer center especially have some kind of patient experience department within them. And sometimes that's where the claims are made, but sometimes it's not. And it's good to find them and get a meeting and get in contact with them too.
Yeah, they're not going to be.
Even,
I've already done it. Yeah.
And they won't force an oncologist or a provider to take a patient back, but it will in the long term. This is the other hard thing with policy. Nothing is quite immediate. It takes a while. So in the long term, that will be something that gets looked at. So I encourage you to still do that. And the steps you've already taken are amazing. And I think very educational for everyone to know that they can do. On the big P side, looking at state legislation and federal legislation, Tigerlily, we have a group of angel advocates in each state. So I really encourage you to look at our angel advocacy program and we can connect you with those advocates in your area as well as the resources we're going to send you. There's a lot of things you can look at to like health grades for providers. You can read about experiences patients have had with them and they're rated on like a star and number based system. And then almost every healthcare center has on their website a list of all their providers, in this case, like breast oncologists, that you can go on and see and read about them and learn about them. If you're not comfortable, leave. I'm not saying stay. A lot of cancer centers also have, not a lot, some have a second opinion center. Which is really great too, to get plugged in there and not even just for a second opinion, but find a good fit within that organization if that's something you're interested in, a new cancer center. At the legislative side, it's a little bit tricky. It's trying to pinpoint and find out what that specific policy is that's creating a roadblock for you. That's something, we're happy to help you with. There's a lot of organizations that work in policy advocacy. I don't know of a Virginia or Maryland specific breast cancer patient advocacy group, but like I said, we have cohorts of angels in those states we can absolutely connect you with, and we'll be connecting with you one-on-one as well to help. But whatever we learn, we'd love to share back with everybody so we can make sure that's part of the process too, finding people who are experiencing the same thing, because then you can bring that to whether it's big P or little p policymakers to get that change. But that's that storytelling. So we'd be happy to help you with that in any way.
You're making all of the right steps. You're headed in the right direction, Pamela. And unfortunately, as we know, in policy, things often move at a turtle pace, and that is not good for us as cancer patients and caregivers and loved ones and friends, but you're on the right path. And I just appreciate you sharing. And the good thing is, you are in this space. We've got your information, and they're definitely going to follow up with you offline and help you navigate, especially as you transition from Virginia to Maryland for your own care. And then also helping those in your community. You mentioned the Girl Scout and others so that you can get the resources and the support you need. And that's the beauty of forums like Pull Up a Seat. That's why we're here, right? To give those resources, to pass that information along. And so at this point, if there are any other questions, I was looking in the chat to see. Please don't be shy. Like I said, we've got a few minutes, 2 or 3, before we start wrapping up. But I want to make sure that I give everyone an opportunity if they have questions. And if not, I just want to say that this was undoubtedly a powerful discussion, right? I want to thank you all of our panelists, all of our guests for coming and being in this space. Thank you for your insights, for your honesty, and your dedication to advocacy and supporting others as we navigate these ever changing policy spaces, right? And even though our policy may change, our purpose never changes. Our mission never changes, right? So whether you are new to advocacy or you're at the front lines, you're leading, you're doing the thing, right? Always remember that it is your story. It is your voice. It is your presence that has the power, and it can and it does shift policy. So let's just remember that, never forget it, and let's keep showing up for one another. Um, I do want to ask if any of the panelists that are left here today have one brief takeaway or closing thought that they would like to share as we close this out. If anyone, feel free.
I'll just share just the takeaway today for anyone that's still on here is that we know that in the world there's going to always be some type of change, and we have to shift and make sure you're staying grounded. And my word has for this year has been unshakable, right? So you can borrow my word, be unshakable, right? As soon as something comes, don't even have to worry about it. I'm unshakable.
I love that. Thank you, Keisha. Lizzie, Aaron.
I'll add in, take care of yourself, trust yourself. You know what you need.
Thank you. Thank you.
And I will definitely be using your word, Keisha, unshakable. That is going to be moving forward with me. So thank you for that. And I would just encourage everybody, take care of yourself first. But if you're in a place to share your story, use your voice to do that, even if it's not in public policy, there's a lot of other ways to do that. And find organizations and communities that will help you do that and give you platforms to do that, whether it's Tigerlily or other organizations. There's a lot of great organizations out there, and it's just important that your voices are heard.
Thank you, Lizzie. So thank you, everybody. As we close, again, I want to thank each of you for showing up today, for us, for yourselves, for your communities, and for your mission. We invite you to stay connected with the Tigerlily Foundation and all of our panelists. I know some of them have dropped their social media handles in the chat, and you'll see them on this slide here, and mine is listed there as well. Thank you for that. And stay engaged with Tigerlily through their programs and events. And you can do that. And if you are interested in becoming an angel advocate and joining this outstanding community, you can email us at info@tigerlilyfoundation.org. Okay? But you'll see all of our contact information here on this slide. And until next time, stay grounded, stay informed, and always stay true to your mission. Thank you.
Thank you again for being with us today, and a very special thank you to all of our sponsors.